GDX can be used for detecting the progression. As everyone has said, goal of the treatment of the glaucoma is to halt or slow the disease progression, and by detecting the RNFL loss or RGC loss and its rate of progression, we help individual finding out who is at risk at early, and better management can be done. The imaging provides reliable measurement of optic nerve head as well as RNFL parameters, but the most important major strength of imaging is its reproducibility and objectivity. The scanning laser polarimetry works on the principle of phase shifting of the polarized light, and the amount of retardation occurred is captured by the detector and converted into the thickness map or into the microns. GDX is very user-friendly machine and has a good reproducibility, does not require pupillary dilatation, and most importantly, it has a age-matched normative database. Basically, it has a default calculation circle which centers on the center of the disc. The diameter of the width of the calculation circle is 0.4 millimeter. If there is a peripapillary atrophy, you can have an option of choosing larger calculation circle. But remember that the calculation circle which comes as a default has a normative database. Other circles cannot have a normative database comparison. The printout of single examination looks like this, where there is a fundus image, parameter table, thickness map, deviation map, and T-SNP graph. All these data can be compared with the visual field in its total deviation plot. For progression, there are two softwares available. One is serial analysis and second is guided progression analysis. Both gives us event-based as well as trend-based analysis. The serial analysis has a nerve fiber layer examination of each visit on this side, which shows you the examination at different time of the visits. Then comes the deviation map, which gives you the comparison from the normals, and the grayscale shown here gives you the comparison from the baseline examination. The parameter tables are there, which are showing you the change from the baseline as well as from the normals. And then at the end of it, you can have a trend analysis plotted in a graphic form. The guided progression analysis compares the measurement over time and determines if the differences are statistically significant. First, you have to have a two baseline field, and then subsequently, whenever there is a significant change, then it is labeled as a possible progression. But if the same change continues on the fourth visit, then it is likely progression. The specificity of this program is 95%. But remember one thing, all the changes that are flagged by the software may not be a true change. There could be a false positive. Now the report looks like this. And when we start looking at this and start reporting, first verify the data quality, which is most important part, then examine the GPA printout in toto and apply the results that you have seen in context to the patient. Here we are seeing the thickness map as well as progression maps. The first part you have to see in the thickness map is the Q values or the quality index, and then TSS, which is typical scan score. If Q is below 7 and the exclamation mark as shown here is there, then we have to check the data quality and we have to retake it. But if there is alignment problem, then the alignment icon will be shown in the triangle. Then we should see that the calculation circle should be well centered, illuminated, and well focused image should be there to calculate it for the progression analysis. And typical cone scar should be very good because it measures the amount of artifact. As shown in this, it is highly atypical image, should be discarded. Now the summary box, RNFL summary box are color coded and displays 3 different colors if the significant change has been detected. If the box color is gray, that means there is no change in the subsequent examination. Here you are seeing the yellow summary box, which suggests that yellow check mark are there in all 3 examinations, the image map, T-SNP graph, and summary parameter charts. So there is a possible progression, and machine has shown the indication that now confirm with the additional examination whether this is a likely progression or not. Then is the red summary box. The T-SNP progression graph here has shown the red check mark, means likely progression. The significant change is detected and reconfirmed repeatedly. So the message here is seek clinical correlation. But the image progression map, if you see, there is a purple check mark, and this is suggestive of increase in the data, which is rarity or not true. So in this case we have to recheck the data quality. Now image progression map is most sensitive to see the narrow focal changes, while the T-SNP progression graph is most sensitive to the broader changes as shown here, and it also shows the calculation circle here, which is divided into 64 segments. Now the image progression map as shown here displays the color coded area which are compared to the two individual baselines. It is important to note that the image map contains more than 9,000 pixels, and at least 150 adjacent pixels should have a significant change. Then only you can have a color coded sign like this. While in T-SNP progression graph, as I said, the calculation circle is divided into 64 segments. So at least adjacent 4 segments should have a significant change. Then only you can have a red sign here. And the T-SNP plot is first two baselines are plotted in a gray line, while the current examination is plotted with the red line. Then comes the summary parameter chart, and it is most sensitive to the diffuse change. The three parameters, T-SNP average, superior average and inferior averages are values are plotted on this plot. And if there is a significant rate of change been noted, then it is displayed as a rate of change here with its value and its p-value significance. Now this is an example. Let us read how to read this. So first look at the quality score. Here it is 8 or more in all the examinations. So this is acceptable. Then RNFL summary box is showing the red sign, a check mark in the image progression. So there is a likely progression in this area. Then there is an image progression map showing you a very narrow focal change in the infratemporal aspect. And similarly, the T-SNP progression graph has shown the deep. But like the previous slide, here the area is not colored red. It is empty because it is too narrow to affect 4 adjacent segments. Then the parameter table, the summary is given here, and there is, because there was no significant change, it was plotted as a straight line. And then you have to compare the findings with the patient's own finding, and here you can see the small wedge defect in the inferior part. Another case where you have seen, you can see the red check mark in these two areas, good quality score. First examination when the change was noticed was in yellow mark, and then it became red. On the subsequent examination the change was reconfirmed. The image progression analysis is also in the red and yellow, and the same is seen on the T-SNP progression graph, and inferior average is also showing you the downtrend. So, and then you compare this finding with the patient's own finding, clinical examination, and yes, it is agreeable to the disc examination as well as the field examination. What are the limitations of the technology? We cannot use in advanced cases of glaucoma. It is affected by the media opacity or anterior posterior segment pathology. Normative database starts from 18, so not useful for the young children. And most importantly for me, it cannot transfer data of patient from earlier prototype to the next generation prototype. And then if you have a tilted disc like this or a peripapillary atrophy, then you have to use the larger circle, and which may not be applicable to the normal database comparison. I use this to monitor all my glaucoma patients, glaucoma suspects and ocular hypertension. It is good for normal tension glaucoma patients where you can take a chance of not treating these patients. family history of glaucoma, we establish a baseline by using this technology, and you can perform it when patient is uncooperative or unable to do this test. We are also using the imaging technology for our neurological patients for their follow-up and monitoring. So to summarize, the new software helps in monitoring of glaucoma patient. GDX GPA provides event as well as trend-based analysis. Rate of progression, location of detected progression, age of patient, stage of disease, and other clinical factors should always be evaluated before taking any decision. Don't take decision only based on the imaging technique. Thank you.